Cosmetic Surgery Clinic, your eyes. We design beautiful double eyelids and shape the image of your eyes to harmonize with the aesthetics of your face. However, because the form and structure of the area around the eyes differ according to the individual, the size and shape of the patient's eyes, the size of the pupils, the height of the nose, the size of the face, the strength of the eye muscles, the condition of the skin and harmony with other organs, and the overall balance of the face all must be taken into consideration when selecting the most appropriate procedure method and the desired shape for each individual patient. For these reasons, although eye surgery is frequently performed, it is also a very difficult and challenging procedure. 1. Cosmetic Surgery Korea. Your eyes, double eyelid. Double eyelid surgery is broadly categorized into incisional methods and non-incisional methods. Each method has its advantages and disadvantages depending on the condition of the patient herself or the length of time required for recovery. And therefore it is highly recommended that you receive a preliminary examination and consult with your surgeon sufficiently before selecting the method that is most suitable for you. 1. Buried Non-Incisional Suture Method. This method requires only a small hole to be made in the location where the double eyelid line will be created, through which the needle and thread enters to form the double eyelid. Because the procedure is conducted through this small needle hole, it leaves no surgical scars and doesn't require the removal of threads afterwards. This method is recommended with patients who have skin on their eyelids that is thin but elastic, and whose eyelids are not prone to sagging. The time length of the procedure is relatively short, lasting around 30 minutes, and it also has the benefit of allowing swelling to disappear quickly. Buried Non-Incisional Suture Method Procedures Sequence. The buried non-incisional suture method is recommended for the following types of patients. If the skin of your eyelids are thin, if there is no sagging around your eyes and there is relatively little fat, if you already have double eyelids but its line is prone to fade out, if you have multiple double eyelid lines, if you can easily form double eyelid lines using tape. Benefits. There is almost no bleeding. There is relatively little swelling after the procedure, and the swelling subsides more quickly than in the case of the incisional method. There will be no traces of a surgical incisional line. It is possible to correct the results if you are not satisfied with your eyelid line after the surgery. You can become fully active just 2 to 3 days after the surgery. Buried non-incisional suture method sample. Further information. Buried non-incisional suture method. A method for creating a distinct fold line by stably fixing the double eyelid. This method is effective for patients who have thin skin on their eyelids and for young patients who have relatively little fat or wrinkles on their eye area. This buried non-incisional suture method hardly requires the use of the scalpel, because it uses a suture thread that is thinner than hair to fix the double eyelid line to create a fold. 4 to 5 tiny needle holes are created along the line where the double eyelid will be created according to the design plan made prior to the surgery, and the thread is passed through these areas to form the aesthetic fold. Pre-surgery cautionary notes. 1. In order to administer sleep anesthesia, you must refrain from eating and drinking water and smoking on the day of the surgery. 2. Hormonal drugs, aspirin, cold medication, and vitamin E preparations, etc. obstruct blood coagulation, and it is therefore recommended that you start to refrain from consuming such substances from 2 weeks prior to the surgery. 3. It is recommended that you avoid surgery during your menstrual period because women are more prone to bleeding during that time. 4. Please wear comfortable clothing on the day of the surgery, and we encourage you to make advance plans to bring along scarves, sunglasses, hats, etc. to wear after the surgery. 5. It is preferable that you refrain from smoking and drinking alcohol for 2 weeks prior to the surgery and up to 3 weeks after the surgery. 6. It is imperative that you inform the clinic of the history of any medical conditions that you have had: blood clotting disorders, diabetes, high blood pressure, cardiac problems, pulmonary diseases, epilepsy, AIDS, etc., and information any complications you have experienced with anesthesia in the past, and must engage in consultations regarding these matters. 7. In order to obtain the desired eyes shape, you must thoroughly consult with the surgeon who will be in charge with your procedure regarding your opinions and preferences beforehand. For the consultation to be productive, we recommend that you examine the shape of your eyes and formulate your thoughts on the parts you most wish to change and the degree of change you desire before coming to the clinic.